Good morning, everyone. Welcome to our Wednesday media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start like we always do with our numbers. As of yesterday, we have 600 confirmed cases, including 6 from Friday, 8 from Saturday, and 5 from Sunday. We did not record any cases on Monday as it was a county holiday. We've done a total of 38,420 tests. We've got 19 people in isolation, another 111 in quarantine. 2 are in the hospital, 1 in the intensive care unit, and we've got 21 active cases and 12 deaths. Today's numbers reporting from yesterday will be out a little bit later this afternoon. With us today, we have Donnell Ewert, the Director of the Health and Human Services Agency, Matt Pontus, the CEO of Shasta County, and Karen Ramstrom, our Health Officer. Thank you, everyone, for being here. And does anybody want to share anything to begin with before we go to media questions? Okay, hearing none, let's go to the media. We are ready for you.
I guess what's going on right now? Are there any updates on anything?
Semi-truck versus racing and unknown injuries.
What was it? What's going on right now? Is that what he asked?
No original of a question is that, but yeah, just how we didn't have board meetings for the last couple of weeks, so I don't know that there's been any new developments.
So I think the key development is what was released Friday, not last Friday, but the Friday before. The state has moved to a new framework, a tiered system, the blueprint for a safer economy, to determine the level of opening and closing instead of being on and off. And so, it's intended to be a framework that could be used ongoing and determines what level of opening and closing based on case rates and test positivity rate and testing volume. And so they've sort of have modified and narrowed down the metrics that they're using to determine the level of risk in our communities, which has implications for the amount of opening we can have for our various industries. And so I think that's probably the main thing that's changed since we last met. We had, a little bit of information last week, but that has continued to kind of evolve and be fine-tuned over the last, week or 10 days or so.
Has move to the tiered system had any effect in Shasta County, or is it too early to tell?
Well, I think the main effect is that, as you know, we were all pleased, was that it allowed opening in some areas that we didn't have before, that were that we felt that we were at a place where we could safely open, such as indoor dining and restaurants. It also allows bars to be open outdoors. I think those were a couple of the major changes. If I recall correctly, also capacity for in places of worship. So, I think in my mind, it's just a little bit easier, and the state website is really useful now. You can kind of see for all the different sectors where we fall, and it's easier, I think, to navigate maybe for the public and for our industries to have a sense of where they are and where they might be if we go backwards or forwards. We're pretty solid in the orange right now in the 3rd tier. So I think that's good news. So we're the second to the bottom, most flexible tier. Well,
which for a county size is pretty good. But can you tell, has it had any effect on the number of cases, or is it too early to tell that?
Our case numbers have been pretty steady. We'll see, if there's anything that comes of the Labor Day weekend. I think that's been a concern, probably nationwide, about what, will people have traveled and had more exposure than they would have otherwise. So we'll see how that goes over the next couple of weeks. But but so far so good. I think the main areas that we continue to focus on are just continuing to work with and prepare with our vulnerable settings, such as skilled nursing facilities, assisted living, other congregate settings. Certainly, I've had conversations around, with regard to the smoke and the fires and that kind of a thing. So that's kind of what we've been focusing on most recently, I would say. So too early to tell, I think, Mike, about whether the tier has impacted our numbers.
Great, thanks, Doctor. That's all I got.
We did have a question from the public. Do you anticipate more cases with individuals evacuating from areas with higher case numbers?
At this point, I don't have a sense that we're having people evacuate to our area, but it's certainly possible. Our hotels, I'm sure, could be impacted. So I don't know that we have a good sense of what those numbers look like and what those areas are. It's always a possibility when there's mixing, and having people come from outside the community. Hopefully those individuals, everybody has sort of been paying attention to what the prevention practices are, and hopefully anywhere that they go, whether it's a grocery store or a restaurant or what have you, is implementing the prevention practices already. So it's definitely something to pay attention to. So thanks for the question.
Thank you, Dr. Ramstrom. Michelle, it looks like you have a question.
I do. Hello, everybody. I had a question about schools. What are you hearing is happening in the schools now that some have gone back in person?
So far, so good. I think the schools we all have been in this learning curve, but they've done a lot of work over the summer to prepare for in-person instruction. As you know, it's sort of a mix across the county about what's open and to what level in terms of the schools being in-person instruction. And the few cases that we have had, very few of students and staff, we have not had any concerns about transmission in a school. They've implemented the prevention measures to identify any potentially exposed individuals and exclude those who tested positive. And so it all seems to be going well so far. I think every situation we learn a little bit and make tweaks here and there. And I think the schools have really done a lot of work in this area, but we're all continuing to learn. But I'm pleased that we haven't had any ongoing transmission related to cases that have been confirmed that have been somehow connected or potential exposure in a school setting.
Okay, thanks. What about in the college setting? Since we have some students going in person to Shasta College, and I am not sure if Simpson has resumed yet, but they're fully on campus.
So Shasta College, we have not had any students test positive that are in-person instruction. I do know at least one that was doing distance learning. Simpson College is actually in the process of doing mass testing of all the students as they come back and their staff. So that's still in the works. So we'll see what those results look like. So they are taking measures to make sure that they're identifying any potential infectious individuals early on so that they can ensure that the individuals that are there on campus, at least from the beginning, don't have active COVID infection.
Thank you.
Any other questions? All right. Well, we will thank you all for being here again this week, and we will see you again next week at 11 o'clock on Wednesday. Everyone have a great, healthy, safe week. Be careful out there in that smoke.
Thank you.